Hi everyone, I am Rosalind Anita, working in Tribhuvan College of Nursing as a nursing tutor. Today, presentation is about first aid measures for choking. So, the choking is a life-threatening emergency that can happen to anyone, children, adults, or elderly people. It occurs when an object blocks the airway and prevents normal breathing. Quick recognition and immediate action can save a life. In this presentation, we will learn the causes, signs, first aid procedures, and prevention methods for choking emergencies. The objectives are introduction, definition of choking, causes of airway obstructions, risk groups, signs of mild choking, signs of severe choking, first steps in a choking emergency, back blows techniques, abdominal thrust or Heimlich maneuver, combination methods, prevention strategies, and conclusion. Introduction. Choking is a serious medical emergency that occurs when an object, food, or liquid blocks the airway and prevents normal breathing. It can happen to the people of all the ages, especially young children and older adults. If immediate action is not taken, choking can lead to unconscious, brain damage, or even death due to lack of oxygen. The first aid measures for choking are simple emergency techniques used to remove the blockage and restore normal breathing. Recognizing the signs of choking is very important. A choking person may be unable to speak, cough, or breathe and may hold their throat with their hands. In severe cases, the skin or lips may turn blue. So, the definition: choking occurs when the airway becomes blocked. The blockage may be partial or complete. Oxygen cannot reach the lungs properly and immediate action is critical. So, the choking happens when food or another object blocks the throat or windpipe. A partial blockage may still allow coughing or speaking, while a complete blockage prevents breathing entirely. Without oxygen, brain damage can begin within minutes, making quick action is essential. So, the causes of airway obstructions: food items, meat, nuts, grapes, and small toys or coins, eating too quickly and laughing while eating, poor chewing in elderly individuals, alcohol consumptions. So many choking incidents occurs during meals. Foods that are large, hard, or slippery are especially risky. Small children often choke on toys or coins because they place objects in their mouths. Elderly individuals may have difficulty chewing or swallowing, increasing their risk. People at higher risk: infants and toddlers, elderly people, individuals with swallowing disorders, people under the influences of alcohol, individuals with neurological diseases. Certain groups are more vulnerable to choking. Young children explore objects with their mouths. Older children may have weaker swallowing muscles. So, the medical conditions such as stroke or Parkinson diseases can also increase the choking risk. Coming to symptoms of partial airway blockage: forceful coughing, difficulty speaking, wheezing sounds, red face, panic or distress. A person with mild choking can usually cough and breathe to some extent. Encourage them to continue coughing because coughing is the body's natural way to clear the airway. Do not interfere immediately unless the blockage worsens. Symptoms of complete airway blockage: unable to speak, unable to cough, no breathing sounds, ants clutching throat, blue lips or skin, loss of consciousness. Severe choking is a medical emergency. This universal choking signs in clutching the throat with both hands. If a person cannot speak, cough, or breathe, immediate first aid is required to prevent death. And first steps in choking emergencies: stay calm, ask are you choking, encourage coughing if possible, call emergency services if severe, and begins first aid immediately. So the remaining calm helps you think clearly. If the victims can respond verbally, encouraging coughing, if they cannot answer or breathe, call for emergency medical help and start first aid procedures right away. Coming to back blows techniques. Stand behind the victim, lean them slightly forward, use the heel of your hand, deliver 5 firm blows between the shoulder blades. So the back blows create vibration and pressure that may dislocate the object. Ensure the victim leans forward so the object comes outer rather than moving deeper into the airway. Performing the abdominal thrust. Stand behind the person, place fist above the navel, grab fist with other hands, push inward and upward quickly. Repeat until the object is expelled. The Heimlich maneuver increases the pressure inside the chest, forcing air upward to remove the blockage. Use quick upward thrust. Continue until the object is removed or the person becomes unconscious. Coming to combination method, alternating techniques are 5 back blows, 5 abdominal thrust, continue alternation until airway clears. If back blows alone do not work, combine them with abdominal thrust. Continue alternating these methods until the object is expelled or professional help arrives. The choking in pregnant or obese individuals. Use chest thrust instead of abdominal thrust. Place hands on the center of the chest, push straight backward. Abdominal thrust may not be safe for pregnant individual or people with severe obesity. Chest thrusts are safer and still effective for creating pressure to clear the airway. Coming to first aid for infants. Hold infants face down along forearm. Support head and neck, give 5 back slaps, turn infant over, give 5 chest thrust. Infants require special care because their bodies are delicate. Never perform the abdominal thrust on infant. Alternate between back slaps or chest thrust until the airway is clear or emergency help arrives. The victim becomes unconscious. Lower the person carefully to the ground. Call emergency service immediately. Start CPR. Check mouth for visible objects. If the victims become unconscious, CPR becomes necessary. Each chest compression may help dislocate the object. Only remove the visible objects from the mouth. Never blindly sweep with fingers. CPR for choking victims. 30 chest compression, open airway and give the rescue breath if trained. Continue until help arrives. CPR helps to maintain the blood circulation and oxygen delivery. Chest compression may also force the object out of the airway. Continue until the victim breathes normally or medical professions take over. Preventing choking incidents. So chew food properly, avoid talking while eating, keep small objects away from children, supervise young children and cut food into small pieces. So the prevention is always better than treatment. Safe eating habits and supervision significantly reduce choking incidents. Parents should be especially careful with the foods like grapes, nuts, and popcorn. Importance of first aid training: builds confidence, saves lives, improve the emergency response, reduce panic during emergency. So the learning first aid equips people with the life-saving skills. Training program teach proper techniques and improve the confidence during emergencies. Communities with the trained individuals are safer communities. Conclusion: choking blocks the airway. Recognize mild versus severe choking. Use back nose and thrust correctly. Call emergency services when needed. Prevention and training are essential. References are American Red Cross Choking First Aid and Mayo Clinic First Aid for Choking and National Health Services Choking First Aid. Thank you for your attention. Choking emergency can happen anywhere at any time, but knowing first aid can save life. I hope this presentation has improved your understanding and preparedness. Thank you.